MARS was established in the fall of 2016 with the vision to bring together global medical affairs, regulatory affairs, and global safety under one area. It was decided to merge these key departments since the MARS area is a part of R&D and contributes significantly across the value chain, right from the early stages of research through all phases of drug development, commercial launch, and until the product is taken off the market. In MARS, we are a rich and wide-ranging organization in terms of competencies, experiences, tasks, and personalities. In GSC, there is a focus on internal job rotations within the MARS areas, encouraging people to explore new opportunities. In the last 1 year, we have seen several movements on internal job rotations within MARS Bangalore. Here are some success stories on internal movements within MARS.
I had been in Rimstream for 7 years. During my 7 years, I learned stakeholder management and improved my communication skills. And I was involved in the quality department. With my current skill set, I can contribute a lot more to the new process, where I will play the role as a quality professional for the global safety, which is linked to the patient safety directly. Until now, I was in the regulatory part of the value chain. Now I am so excited to work in the safety department.
What inspired me to move to GMA was gaining exposure in an area outside my area of expertise. During my IDP discussions, I'd always been working towards what's next for me. And this move simply started as an opportunity to explore what's available across MARS. After the initial exploration, I had a healthy discussion with my manager, my grandparent, and also colleagues from my new area. And these discussions really opened my eyes up to the opportunities available across MARS, which further inspired me to make this move.
Well, there have been quite a few challenges, I must say. It was a new department with all new people, and honestly, it felt like I was away from home. Also, the organizational changes that happened right after I moved to RA had some impact. But having said that, I must also say that the support and motivation that I received from the management and the colleagues in RA and safety was immense. A big thank you to all of them. The teams in RA helped me to understand their processes, the transition was good, and the managers in the department also extended their support in many different ways. It has been a fantastic journey so far in RA, and I'm sure that's why we say NN provides life-changing careers.
Coming to challenges, I won't say it's been an easy transition. Of course, it takes its own time. Novo Nordisk has been is a very complex organization. I've been part of Novo Nordisk for the last close to 12 years now, worked in different parts of the organization. But coming to global safety, it itself been a very new learning experience for me. Being part of Carsten and his management team and also learning from their experience, and also being part of the management teams here and learning from the wealth of experience they have. I think it's been extremely satisfactory. In this process, the most important things I would say, one, we need to be open-minded, we need to be flexible, and most important, we need to be humble to make this transition successful.
Yes, in my previous role, I was working with different global stakeholders, and recently I had an opportunity to be the part of Global Safety Conference execution team, which was held in Prague. And as an execution team member, I had an opportunity to handle the event, working with different global stakeholders, and these all learnings are quite helpful, and I am able to utilize this in my current role.
The learnings from my previous role as a safety operations advisor have definitely helped me. I now have an enhanced understanding of the use of drug safety data when I look into clinical trials. Reviewing investigator-sponsored studies in global safety has given me a better perspective of the ISS process, and overall, my learnings from safety have sensitized me to the different steps involved in the life cycle management of a drug.
I am utilizing my technical skill sets which I had learned in preparing scientific materials. And second thing, I am able to deploy processes to set up new strategies. Also, I am able to utilize my knowledge sharing abilities now to train newly recruited person to the same position.
Looking forward to more collaborations and success stories.